Hello everybody, happy Wednesday afternoon. My name is Elise and welcome to my tea table. We're having a Constitution study group today because that's what we do every Wednesday afternoon. Today is no different. Every week we get together, we read various documents and take a deep dive to understand various topics as they pertain to the Constitution, as it pertains to our civility with one another, which time and time again we come to realize that simply means our capacity for politeness. So today's topic is on public health. I did a study on this about a year ago, kind of related to a similar topic, but I wanted to revisit this topic because it seems to be a hot debate among people in my friend circles, as well as in discourse I've been seeing online and social media, and that's around, hello, thank you for the hearts, thank you so much, love you very much. I'm using a cool little retro filter on Instagram. I kind of like it. It's kind of a cool one. I am also streaming online at tlet.tv. If you want to have the full interactive experience, you are welcome. Hi, Uncle Iro. Good to see you. I hope you're doing well. It's been a while since I've been in one of your lives watching your art. Every Wednesday I come on in the afternoon and we co-learn. It's a co-learning experience. I am not teaching here. Sometimes it may seem as if I'm teaching, but I'm learning this stuff just like you all are. And end up learning a lot through chat and through the comments. And so I know today's topic may be a heated one. And I welcome it. I welcome opinions. I welcome questions. As usual, I always welcome that kind of stuff. But I think this topic, particularly concerning the CDC. Teacher and student. I've got to find a T pun for student because as I've been learning from good friend Ray from Grass People Tree, a good teacher is just as good of a student, and I've been taking that very seriously. And perhaps a better term to use instead of teacher is facilitator. I like that. It's a bit less power dynamic, because that's what I'm trying to avoid here is any kind of power dynamic, because I am just as blind and walking in the dark as everybody else is. I'm just mentee. I like that. That's a good one. Yeah, a good teacher. Ray has taught me a lot about that even if you're far along in your educational experience, a good teacher is going to continuously be learning from you as the student, and so it kind of evens the playing field between the mentor, the mentee interaction, and so that's why perhaps the term facilitator is more appropriate, more understanding of that dynamic. So I am facilitating this conversation today. I found some articles, of course, as usual, that we'll look over, really kind of just understanding the history of the CDC. Where did the CDC come from? Where did it acquire its constitutional influence? And perhaps if chat takes it there, which I'm welcoming, I'm holding space for chat to take it to some discourse on the current decisions the CDC has been making, because it seems as if there's been some sudden change in the tone from the CDC, specifically around the trust of each of us as individuals' capacity for honesty, for honor, and for politeness, because that's what civility actually means. You know, you think about civil, you think of city, people associate the word civilized or civil to a city, and even the word city, like what is a city? A city is like a harmony of how people can live among each other. Which does require some capacity for politeness. So that's as simple as civility is. It is not politics. It is not, hierarchies. It's fucking not capitalism or money at all. Although those are all tools, and the importance of the Constitution is the protocol in which we regulate those tools, in which we utilize those tools in order to be civilized with one another, in order for us to interact, to coexist with one another. I'm gonna drink some tea though. I think I'm gonna start out with a little tea drinking before I jump too deep into it. Stability, I like that one. That's a good one. I always love the tea puns. Keep them coming. Keep them coming. Stability, civility. Hi Marie, good to see you. Oh, happy Wednesday. Talking about public health today. Marie, we were chatting this morning about World Tea Expo, which is going to be occurring here in Las Vegas. Hi Chris, good to see you. We're going to be hosting World Tea Expo here in Las Vegas. I look forward to welcoming all of our tea friends that do decide to come to Las Vegas for that event. My tea room is not far at all from the convention center, which is where the tea conference is being held. So I do plan on holding space. And related to the topic of today, Las Vegas is in an interesting position in regards to the pandemic. It was probably one of the hardest hit cities when shutdowns happen, when restaurants close, because the economy here is very much reliant upon hospitality, upon tourism. So now that things are starting to come back to normal, and the CDC makes such a big announcement like what they made last week about vaccinated people not needing to have masks, the casinos and all of the major gathering points for tourists here in Las Vegas have made public announcements that their stance on it is that they are going to utilize the honor system, because how else are they going to police it? So that's understandable. And so if you choose not to wear a mask, if you won't be wearing a mask, they will assume their staff, their management, the business. I think the notice that I saw was from Caesars Entertainment, which is one of the large holders of the casino properties here in Las Vegas, that they will assume that you are vaccinated, no questions asked. So that, leaves a big question about what does this mean for our civility with one another, because I have not gone to the Strip. I am vaccinated, but I have also chosen not to socially engage, not just yet. It's not that I don't feel safe. I feel safe. I feel like there's still solidarity for me, and health privacy is important. You're right about that. So it's a slippery slope. It's really difficult to navigate this. And so I think it's just important for people to understand the context of what's going on, so they can make wise decisions for their own personal health. For me, like I said, I feel safe. But there's a big question in solidarity, not just solidarity with here in the States, here in Las Vegas, the people visiting Las Vegas, but I'm thinking more of the solidarity of people around the world that still are dealing with this pandemic in a very serious way, and have not had their local government make such statements like the CDC has made. So it's but I know it's going to be a highly contested issue. So I do welcome opinions. I do welcome discourse in today's session. Yeah, I feel like solidarity is still important, and that's not just solidarity here, which was kind of the question last year. So that was when I went over this topic last year. It was like, why wear a mask? Well, even if you're healthy and you're not at risk, it's like it's in solidarity with everybody else, right? That was kind of what it boiled down to, and that's the politeness. That's the politeness that we practice with one another. But now this is an international issue, and traveling does make traveling interesting. So I am going to be having an Orthodox longleaf tea from Assam, India. This is not handmade. So I think a couple of days ago, I was enjoying a handmade black tea from this garden and factory, but this is more of the bulk tea making, like the normal Orthodox. That's kind of confusing for people. Maybe this is a good chance to describe the difference between Orthodox, CTC, or commodity level tea. So in the broad definition, Orthodox is an Indian tea industry referring to like full leaf tea, like the traditional way of making tea. Oh, look how beautiful that pour was. The traditional way of making tea in the factories, even if using equipment, not handmade, but even handmade, everything was just called Orthodox when CTC processing was developed. So that wasn't until like the 1970s. So the concept of Orthodox teas is kind of a new concept. It's how we differentiated from the past to the present. But now it's kind of important to add an additional qualifier because there are so many gardens in India that are starting to do hand processing, artisanal level tea, because now Orthodox tea is pretty much anything that's not CTC, the crushed tercrol, which is the little pellets of tea that you usually see in a tea bag. So it can still be made in very large batches. It can still be made with lower quality leaf, but Orthodox just means full leaf. It hasn't been broken up into the little pieces. And so I think it's also important to differentiate handmade or artisan tea to be different than Orthodox. Although technically, if you were in India, you could call it Orthodox and people would understand, that it's different than the commodity tea. So the other day I was drinking a very beautiful hand-rolled, handmade black tea, which I would not call Orthodox because I wouldn't want that to get confused with like a bulk tea that is full leaf. Yeah, whole leaf. Nick, I think you're right. Honesty is the best policy. How do we write that into the Constitution? I mean, that would be the best. That would be the best. And then, as we, what the research that we'll do today, the reading that we'll do today is looking at the organizational structure of the federal government, of like where the CDC falls in, right? So what office, what department is the CDC in? What gives them power? And so that if we wanted to bring it back to this honesty is the best policy, would it be appropriate for the CDC to be making that type of call? I don't know. We'll see. If you have ideas or questions now, you're welcome to pop them out, but you're also welcome to stick around and figure them out as we go. Honest tea. You're making all the tea puns tonight. I like it. Yeah, honesty. Because obviously, honesty is not being practiced. If you look at the ratios, I think like the highest estimate is 40% of the people in this country, which is an incredible number. That is an incredible number compared to other countries, which are, less than 10%, less than 5% vaccinated, fully vaccinated. But if you walk into the casinos now, by far more than 40% of people are unmasked. So the math doesn't add up. I'll have to steep in that one, Uncle Iro. Uncle Iro says that the tea puns are their specialty, and they take every opportunity. But you chai. I know. I see you chaiing. Hey Don, good to see you. So you say that you're fully vaccinated and still wear your mask, but more for political reasons. I don't want to see as an anti-masker. See, so there's that. I'm not really concerned about that so much. I'm more concerned about being seen as a person in solidarity with the world. Which I guess maybe, I don't know. Maybe I just like to focus on the positive spin on things versus the negative spins, because I'm not trying to call out anti-maskers or say that they're being any less polite, because that too is a slippery slope of, gatekeeping things and being the one to make judgments on things versus just trying to live your best path. And best case, you influence someone else. Yeah, I'll have to steep on that. So yeah, that's related to World Tea Expo coming up. I have a feeling that that's going to be a common topic of conversation among people on the show floor. Because here in Las Vegas, if you come visit, unless you go to an Airbnb, which is what I do recommend if you are concerned, if you aren't vaccinated and you are concerned for your health and your wellness, stay in an Airbnb. That's going to be your best solution. All the restaurants are still practicing. I mean, everything's at 100% capacity. We're completely open now. But the casinos is where there's high density of people, and Las Vegas is busting right now. I heard that the month of April was the highest grossing revenue month in Las Vegas in 8 years. So even before the pandemic, making more money than 8 years ago, which is great for the city. It's great, the economy here needs that. It was very hard hit at the beginning of the pandemic, but now what that means is that it's very busy, and yeah, it's impressive. I mean, it's great. If you work in the Strip, which actually a lot of people aren't, so that's a topic that I usually cover on Monday nights, is on the hospitality industry and the issue with labor shortage and whatnot. But it is busy. It's busy. The casinos are packed. So if you are concerned for your health, it's better just to stay at a private residence, so that way you don't have to have any kind of fear or ideas, or even if you're just worried about the political thing on it, even if you are vaccinated and you feel safe, but you become emotional in seeing 80% of people without masks on, knowing that mathematically it is impossible for that to be working out that way. Just best to stay away from the Strip. I have seen that the convention center is following mask protocol. Yeah, people want to go. People want to have fun, and so that's another thing. When you think about the people that do want to go to Vegas and don't care about this stuff, are the people that probably haven't, taken the pandemic the same way that somebody who stayed on top of knowing when the vaccine was available to them. You know what I mean? Like, I'm not trying to call them anti-vaxxers, because I don't know that. I have no idea about that. But, like, they probably weren't, like, super pro-vaccine. And I would think that, like, 40% of people that are fully vaccinated now were, like, the people that were the most proactive, the first ones to get there, because I've been fully vaccinated myself, and I did this because of travel. And I'll say my personal opinion on it. I wasn't, like, in a hurry to get vaccinated personally, but when I started planning my trip to India and seeing that it was going to be possible, of course, it ended up not being possible, but in March, before they had the spike in cases there, I was planning everything, and I knew, you know what, if I planned to travel, it would be more responsible for me to get vaccinated and go through all of that. So I got in early. I found out, like, I wasn't even, here in Nevada, they had categorized, you know, the group of people that I was in the priority line as a food supply chain worker. You know, so my work granted me the opportunity to get the vaccine a little early. But just maybe like 2 days after I got my first dose, they opened it up to everybody, which was great, you know. But it hasn't been that long, you know, so anybody who is fully vaccinated at this point had to, like, done it early, you know what I mean? But I've got a friend that is helping administer the vaccination in New York State. And like a month ago, they were busy, which was great. You know, around the clock, 24/7, he was constantly having to take supplies around, deal with all of the different sites that were administering the vaccines. But now, not busy at all. They're, like, having to throw out incentives to get people to make their appointments, giving baseball tickets. I heard now some of the states are even offering, like, a lottery. You can get money, you can get paid. It's interesting. It really shows the dynamic between the different groups of people. So that's enough judgment from me. I think that's enough. That's enough judgment on that topic now. This tea is very good. Super, like, rich, malty, characteristic of Assam tea. Compared to that hand-rolled tea I had a few days ago, that one was a lot softer and gentler. This one is a bit more sharp, but not too much. Of course, I am brewing it very lightly. I'm using boiling water, but I'm not steeping it for longer than 30 seconds. $1 million, Marie? Is that how much money you want to get your vaccine? All I know is when I went to the Peace Corps, when I went to Africa to the Peace Corps, we were freaking human needle pokers. Like, every day it was a new vaccine for like 2 months straight. Every day, just new vaccine, like, and we had no consent or no option. It was like, either get these or see you later, Uncle Iro. Thanks for hanging out. Love you so much. Oh, you got the lottery from Ohio? That's it. Oh, they're giving $1 million. Oh my goodness, that's crazy. That is crazy, Marie. I can't believe that. Well, whatever. Their prerogative. Every state can do how they want to do. Yeah, I was given, like, so many vaccines, and I was like, I felt really empowered by it. You know, I was like, oh, so I'm not gonna ever get sick. I'm gonna be invincible now. This is great. I can do whatever I want in Africa. And I ended up getting really sick at one point, quickly after I had moved there. Maybe like 2 months after I moved to the village I was living in. I got the weirdest illness I've ever gotten in my entire life. It wasn't like debilitating. 5 people are gonna get $1 million. I think it's time to go move to Ohio and get your vaccine. Jeez. That's crazy. I can't believe that. Oh well. So they've gotten 2.7 million people. Well, I guess yeah, they got some people vaccinated. That worked. I heard one state, I don't know if it was Ohio's lottery, but some state has already chosen one of their winners. It was a woman. But yeah, I ended up getting super sick. I woke up one morning at like 3 o'clock in the morning, and I had this like lump in my throat. It was like the size of a freaking softball, and it was throbbing. Boop, boop, boop. Ugly. It was an ugly, ugly thing. And I was freaking out. I was like, what the heck is this? And they next morning took me on the bus to the capital city to go to the hospital to meet with the doctor. And the doctor tells me, well, it's one of two things. It's something that we've referred to as cat scratch fever, which is a bacterial infection, which is a fucking real thing. I never freaking knew. I thought it was just a silly song from the 80s. But it could either be that or it could be mumps. And I was like, wait. I got the mumps vaccine. That was among one of those vaccines that I got. And he was like, yeah, but you know, vaccines don't actually work. And so ever since then, I haven't been the first one to jump in line for vaccines. Of course, if I'm going to travel somewhere, yes, like, and you don't want to be spreading what you have and creating more trouble than good. But, you know, I think it's good to keep in mind that vaccines don't make us invincible. But just to finish the story, they put me on very strong antibiotics because that was their theory, and I think that this is the theory in a lot of like modern medicine. When you have you can't really test for one or the other, and you just have to like do something to figure out what the problem is. They said, we'll put you on these strong antibiotics. If you get better within 2 days, it was the bacterial infection. It's the cat scratch. If you don't get better, it's mumps, and that's viral. There's no cure. You're just going to have to like stay in the hospital and wait it out. And so I ended up getting cured. So I did. I had cat scratch fever, which means I didn't get the mumps, which was great, which means maybe the vaccine worked, maybe, you know. But, you know, just the fact that the doctor had told me that, like, he was just, like, fully convinced it was, like, a 50-50 chance that I had one or the other. And that the vaccine, you know, really doesn't fully protect you. It does do a lot. Obviously, that's why they still have them. And that's why we're having this conversation today. But just a related story I wanted to share. So yeah, I had cat scratch fever. I never took a photo of it. I was too embarrassed. I totally should have. I wish I had the evidence of my cat scratch. So Dawn, I'm gonna get back to your comments. I'm sorry, I was sharing my story. So you said you don't know anybody going to Vegas. You work 12 hours in a lab in a full bunny suit and mask, so it doesn't bother you. Yeah, the mask don't bother me at all, actually. I still wear them even if I go into the gas station. It has nothing to do with like how other people view me or whatever. It's just what I feel comfortable with. If you're super high risk and you were last on the list, all my young healthy friends got it months before me because they were essential workers that were sitting home not working. Yeah, that could be frustrating. Oh, that's an interesting point. So Don, in relation to the story that I just shared about vaccines not being 100% effective, he says, just because you wear your seatbelt doesn't mean that you can't die in a car crash. Very good relative thing. But there's a reason why seatbelts are illegal, you know, wearing are a part of our legal process. Bitcoin, you want to come up? Come here. Come here, baby. You want to come say hi? Come here. Come here. Up, up. Up, up. Oh, you got me here, Joan? I'm being lazy. I guess not as lazy as you. He's a lazy boy today. He's so cute. Stinking adorable. Every time. Every time. We are so blessed. We are so blessed. Yeah, go to Ohio. You can get $1 million with your vaccine. All right, time to do a little research. Enough tea time, enough story sharing time. Okay, here's the history of the CDC. This is from the CDC website. I'm gonna make it a little bit bigger so you can all see a better. CDC. On July 1st, 1946, the Communicable Disease Center, so that was the original name for the CDC, opened its doors and occupied one floor of a small building in Atlanta. Primary mission was simple yet effective, yet highly challenging: prevent malaria from spreading across the nation. Armed with a budget of only $10 million and fewer than 400 employees, the agency's early challenges included obtaining enough trucks, sprayers, and shovels necessary to wage war on mosquitoes. And you want to just sit on my lap? Is that what you're looking at? Here, come on. Oh, such a needy guy. All right, this will work. Yes, this works, Bitcoin. This works. As the organization took root in the South, once known as the heart of the malaria zone, CDC founder Dr. Joseph Mountain continued to advocate for public health issues and to push for CDC to extend its responsibilities to other communicable diseases. He was a visionary public health leader with high hopes for this small and at that time relatively insignificant branch of public health service. In 1947, CDC made a token payment of $10 to Emory University for 15 acres of land on Clifton Road in Atlanta that now serves as CDC headquarters. The new institution expanded its focus to include all communicable diseases and to provide practical help to state health departments when requested. Although medical epidemiologists were scarce in those early years, disease surveillance became the cornerstone of CDC's mission of service to the states and over time changed the practice of public health. There have been many significant accomplishments since CDC's humble beginnings. The following highlights some of CDC's important achievements for improving public health worldwide. Today, CDC is one of the major operating components of the Department of Health and Human Services and is recognized as the nation's premier health promotion, prevention, and preparedness agency. There's an art to the CDC. They have a museum. Okay, this is interesting. Oh, it's closed to the public because of COVID. They don't want to, so here are the things. They said, discover the stories behind the historic objects of the CDC Museum. Learn why they are valuable to CDC's history and how they became part of the collection. Welby, a character created by Harold Walker. Anybody remember this? They had a little mascot. I want to see that. That's interesting. Oh, so it's from 50 years ago. It's kind of cute. Little cowboy wellness bee. More than 50 years ago, when CDC was still the Communicable Disease Center, Public Information Officer George Stenhouse wanted to develop a public health symbol that could be used by all states and local public health agencies in the U.S. In response, staff artist Harold Walker, who had previously worked on an animation in Hollywood on cartoons such as Felix the Cat, took his drawing board to design Welby, a cartoon character that exemplified well-being. Could you imagine if we had this Welby everywhere, like trying to tell people to wear their mask, get vaccinated? He's got his little stinger, his little bee stinger, his like a little syringe ready to give you the vaccine. That'd be cute. Welby was first introduced in March 11th, 1962. And when did we get rid of it? He spoke Spanish in New Mexico, the bee. He came to life in costume in Hawaii and led a parade. On CDC campuses, a Welby decal was placed on employee windshields to help identify cars in the parking lot. That's interesting. So how long did we use this Welby? Oh well, kind of irrelevant to today's conversation. Red spots. Okay. Let's read something a little bit more relevant. This is coming from the Constitution Center, which I have referenced several times in past group studies together. I find that the pretty unbiased perspective in the articles, strictly just referencing various court cases and laws. So this was really the only thing that I could find. I mean, it's published in March 13th of this year, so it's current. Titled "Constitutional Powers and Issues During a Quarantine Situation," as specifically addressing the CDC, which in that history from the CDC website that I just read, you saw that, or you heard that, the purpose of the CDC is to provide advice when asked for it, and not to provide direct laws or, oh, look at me, I'm in the COVID on the green screen. That's funny. I'm like, yeah, I'm swimming. I'm just a little COVID swimming around. So it's interesting, that's why I wanted to do research today, because I didn't really know the scope or the influence the CDC had. And so this article will address some court cases, I believe, and give us more perspective about where the Supreme Court is understanding in the current situation. The growing concerns about the coronavirus in the United States could lead to government officials considering isolation and quarantine as possible measures to contain the virus. So what does that mean in constitutional terms? So far, people exposed to COVID-19 virus have agreed to self-quarantine or voluntarily remain in isolation in consultation with medical authorities. In Santa Clara, California, and San Francisco, officials have banned large gatherings. In New York, they have containment area. While in Pennsylvania, on Thursday, closed down public schools. I think this is an old article. Anyway, but what happens if the federal officials or a state government needs to get directly involved in a situation where a large population of groups need to be isolated? Or what rights do individuals retain in border entry situations? According to the CDC, state governments and not the federal government have most of the power to place people in isolation or quarantine under certain circumstances. But in some cases, federal and state officials have overlapping roles. The difference between an isolation and quarantine situation is important. Isolation separates people known to be ill from those people who are not sick, says the CDC. Quarantine separates and also restricts the movement of people exposed to a contagious disease but not yet ill to see if they become sick. In 2014, the Congressional Research Service wrote about quarantines in the federal constitution when there was concerns about the Ebola virus. In general, the Research Service said the power to take quarantine measures is reserved to the states under the 10th Amendment. In 1824, Supreme Court Chief Justice John Marshall's opinion in Gibbons versus Ogden drew a clear line between the federal government and the state governments when it came to regulating activities within and between states. Marshall's reasonings set the precedent that police powers are reserved to states for activities within their borders, with some exceptions. Those police powers include the ability to impose isolation and quarantine conditions. Marshall wrote that quarantine law form a portion of that immense mass of legislation which embraces everything within the territory of a state not surrendered to the general government. The Research Service also noted that one trend in common today among the states is the antiquity of their quarantine laws, with many statutes between 40 and 100 years old. To be sure, the federal government has important quarantine powers. Under Section 361 of the Public Health Service Act, the U.S. Secretary of Health and Human Services has the power to take measures to contain communicable diseases from foreign countries into the U.S. and between states. The CDC acts on behalf of the Secretary in these matters. Federal public health and welfare statutes also give the federal government authority to isolate and quarantine persons with certain diseases based on an executive order issued by President George W. Bush in 2003. The federal government also has a seldom used power to impose large-scale quarantines. For example, the federal government issued isolation and quarantine orders during the influenza pandemic of 1918 and 1919. I don't remember that. I actually studied that pretty deeply, that each state... Oh, Bitcoin, I spilled my tea on you, boy? Are you angry at me for doing that? That's okay. You're gonna smell nice. You're gonna smell nice and malty now. Yeah, it was kind of the same situation back then, where each state was able to make their own judgments and do their own thing. The Bitcoin looks really good in this filter, huh? Like really clean. He looks really clean and young. Huh, baby? He's pretty filthy right now, so. But under the Constitution, individuals have rights in quarantine and isolation conditions. Under the 5th and 14th Amendments, right of due process and equal protection, public health regulations used to impose such conditions can't be arbitrary, oppressive, or unreasonable. There are precedents where courts have ruled that states or local governments didn't meet a burden of proof to justify a quarantine. For example, in 1900, courts ruled against the city of San Francisco when it tried to inoculate and then quarantine Chinese residents against the bubonic plague when the court had doubts that plague conditions existed. That sounds terrible. Why wasn't that in the fucking Asian Pacific Island heritage study that we did a few weeks ago? And there are also precedents that authorities should provide confined people with an explanation about why they are confined and notify them that they have the right to counsel or other constitutional provisions. A current example of a federal quarantine order related to the COVID-19 virus on the CDC website outlines many of these principles of people arriving in the U.S. and reasonably suspected by the CDC of exposure to or an infection with the coronavirus. Those quarantined have the right to a medical review and to ask a federal court to review your federal quarantine, including any rights to habeas review. Also, the federal government does have an update plan to cope with a national influenza pandemic, first developed in 2005 and last updated in 2017. It's called the National Pandemic Influenza Plans. Deal with isolation and quarantine options if needed. All right, I'm going to open that in a new tab. Of course, one final question is, how can the government enforce isolation and quarantine conditions? On Friday, the Wall Street Journal reported that people in Missouri and New Hampshire recently violated self-quarantine order to attend events. Enforcing those orders is problematic, said one expert. It really is pretty much the honor system, says Polly Price, a professor of law and global health at Emory University. Public health people themselves can't arrest someone or force them to stay somewhere, and they try to use that as an absolute last resort. Government agencies do have the power to take action if needed. For example, in Pennsylvania, violators of the communicable and non-communicable disease code may face fines and imprisonment in county jail. Let's see this list. I wonder if this is like updated. Because then I'm thinking, okay, so the CDC made that announcement, right, last week. Let's see, where are we at in Nevada? I like this track. This is cool. I'm trying to get the title. Wait, I gotta get up. I gotta read this. I can't read it. Aqualescence? Cool track. I like this one. Alright, back to the research. Nevada. Isolation, quarantine of persons, groups in person. Okay, so this is our regulation. Okay, that, nope. Nope, not interested in that. So yeah, I was interested in the state's current position about the pandemic, right? Because each state is allowed to create their own boundaries, their own rules, and whatever the CDC says is just guidance, right? So it was kind of interesting how that announcement was made, and like immediately the same day, all the casinos started to like put out their marketing and started to make their announcements of, you don't need a mask, you're vaccinated, come hang out with us, no mask. Okay, so this is our website, nvhealthresponse.nv.gov. So it's got all of the case numbers. We currently have 147 new daily cases, so we still have cases. Let's see, state information. I guess this is going to be the place where it'll be. All I know is that like June 1st, we were supposed to reopen at 100% capacity, but it was still requiring masks. Let's see, maybe the press releases. Our last press release was from the 26th, which was just a few days ago. Oh, I see. Okay, so Nevada, the state did update its mask. So it's this was from the day the CDC made their announcement on the 13th. They issued update guidance that fully vaccinated individuals do not need to wear a mask in most indoor and outdoor locations. On May 3rd, Governor Steve Sisolak signed Emergency Directive 045, which updated the mask and face covering requirements for the state of Nevada to align with the CDC's recommendations on mask usage, including any subsequent guidance issued by the CDC. Below are the updates. So the state of Nevada neither requires nor prohibits private entities from confirming vaccination status of individuals. Employers and organizations are encouraged to post signage with the latest CDC mask guidance for vaccinated and unvaccinated guests. Private entities and organizations may have mask policies that are more restrictive than the CDC guidance. In general, people are considered fully vaccinated 2 weeks after their second dose. All right, so the state did update its mask mandate, so that explains why we were so quick. We were so quick to make that change. This is something a little going back to the CDC. Now that I understand, so the mask mandate from the CDC really was just guidance, and the states did ultimately still make their own rules. They just are referencing the CDC recommendation. You know, which means that still the CDC is not a political machine, but then of course anything can be. Because this seemed like such a fast change in tone from that organization, from, you know, what we had been hearing. But this is back to the CDC and their constitutionality and influence, not about masks. So this is from law.com. Which is a legal online magazine. I'm not too sure about the political sway of this publication. Maybe we'll find out after reading the article, but we're just reading this article at face value just to get the information and hear the story that's here. This was published 4 days ago. Super relevant. Recent rulings on CDC eviction moratorium signal constitutional fights to come. So I had heard about the eviction moratoriums. I mean, that was a big move that happened last year to protect people from being evicted if like they couldn't pay or whatever, for whatever reason. I had no idea that the CDC was involved in that. I thought that was just, you know, an executive order directly from the president. So let's learn. A recent Texas federal court ruling declared unconstitutional the CDC's residential eviction moratorium, may be the opening salvo in a fight to determine the extent of federal power during a national health crisis. The ruling in Turkle versus CDC could result in a wave of new case law on federalism, the Commerce Clause, and the ability of Congress to delegate power during historic crisis. Further, a simple case on appeal to the U.S. Court of Appeals for the 11th Circuit will be closely watched by Florida landlords. On September 4th, 2020, the CDC issued the temporary halt in residential evictions to prevent the further spread of COVID-19. Coming from the CDC. CDC made this order. I don't even know how that's possible, because they are just like a bureaucratic system that's meant to be strictly a reference point. The original order, which was set to expire on December 31st of 2020, was extended until March 31st, 2021. Under the CDC's order, landlords, owners of residential property, or those with legal power to pursue eviction were prevented from evicting certain covered persons from residential property. The CDC viewed the moratorium as a valid exercise of federal authority to reduce the spread of COVID by limiting movement or preventing homelessness, a justification couched in the Commerce Clause of the Constitution. Interesting. So this didn't have too much to do about economic support for people. It's rooted in public health, justifying that we need to stop evictions because, we need to support people to be able to stay confined, safely stay confined. I had no idea. I thought it was strictly like an economic stimulus type of thing, which of course it does end up being, but it's interesting how the actual order is framed as being, for public health. Until the Turkle ruling, most courts accepted the government's justification for the moratorium, including a decision currently on appeal to the 11th Circuit. In fact, one of the opinions holding the moratorium constitutional is from a court located in the 5th Circuit, which will hear an appeal of the Turkle decision. Chambliss ruling prevents conflict of law. In Chambliss Enterprises versus Redfield, a district court in Louisiana determined that the CDC order and its authorizing statute was constitutional. The landlord plaintiffs in Chambliss sought to invalidate the moratorium on the premise that Congress had impermissibly delegated its lawmaking authority to the CDC to ban evictions, violating the non-delegation doctrine. The court dismissed this latter argument on the grounds that Congress had provided an intelligible principle to guide the CDC, and that Congress intended to defer to agency expertise. More importantly, the court briefly addressed whether enacting the moratorium is within the scope of federal powers and ruled that the government action falls within its rights to regulate interstate commerce. The court referred to the Supreme Court's holding that when Congress undertakes to act in an area fraught with medical and scientific uncertainties, legislative options must be especially broad, and courts should be cautious to rewrite legislation. See Marshall versus United States, 1974. And that was in the other article that we looked at, that's the case that they're referencing there. Finally, the Chambliss court held that the order overrode any state regulations pursuant to the Supremacy Clause. While Chambliss is a prima facie non-delegation matter, the ruling appears to make other constitutional arguments for the order's validity. So the 11th Circuit rules in favor of CDC. In Brown versus Azar, a district court in Georgia similarly held that Congress had granted broad, flexible powers to federal health authorities that does not violate the doctrine of non-delegation. The court even went further to comment on the CDC's order, arguing that it is reasonably calibrated to the seriousness of the disease it is combating. The plaintiffs in this case put forth another argument that state and local protections against evictions are sufficient. The court re-employed the holding from Chambliss as to these federalism and supremacy clause issues. The court noted that states such as Georgia, where the litigation was pending, had no restrictions on evictions at all, thus requiring federal relief. Indeed, one of the stated purposes of the moratorium was to provide some relief in states which did not limit evictions. The court once again dismissed the non-delegation argument. Like Chambliss, the Brown court bolstered the CDC's argument that the federal government has inherently broad powers to regulate during a crisis comparable to COVID. The plaintiffs in Turkle, rather than challenging whether Congress could delegate the power to halt evictions to the CDC, question whether Congress itself even had the authority to prohibit evictions in the first instance. Unlike previous courts, which appear to take for granted Congress's ability to delegate, the Turkle Court questioned whether the Commerce Clause could be used by any federal government actor to halt eviction wholesale. Ruling in favor of the plaintiff landlords, the court held the CDC order exceeds the power granted to the federal government to regulate commerce among the several states and make all laws which shall be necessary and proper for executing that power. By invoking the necessary and proper clause, the Turkle Court made clear that the power to enforce an eviction moratorium is both non-delegatable and outside the jurisdiction of the federal government generally. This ruling effectively means that state eviction moratoriums, or lack thereof, are sufficient to regulate local issues like eviction. Chambliss and Turkle have been appealed to the Fifth Circuit Court of Appeals, and Brown has been appealed to the 11th. Due to the conflicting theories in Chambliss and Turkle, the Fifth Circuit might be the first appellate court to decide whether the CDC's orders is constitutional. If the moratorium is extended past its March 31st end date, there will potentially be a flurry of lawsuits by landlords on this very issue. For Florida landlords, the decision in the 11th Circuit Court of Appeals will be closely watched. In the meantime, these cases may portend a new frontier of litigation with respect to the emergency powers of the federal government. Interesting. I want to look into that. I'm still surprised. Like, I had no idea the CDC was behind the eviction moratorium. All right, so here it is from the actual CDC website. Let's see what they said about it there. Last updated on April 13th. So it should be over, right? Because they said March 31st was when it was extended to. Let's download PDF. Yeah, I mean, this document, it has CDC letterhead on it. The Center of Disease Control and Prevention has issued an order that may protect you from being evicted or removed from where you are living. This means that you may be able to stay at the place where you live through June 30th, 2021, if you qualify. I don't get it. I thought it was supposed to end on March 31st. So how to use this form. See if you qualify. Sign the declaration that you qualify. Give the signed declaration page to the individual or company you rent from. And then you're excused. So there's two main questions you have to answer if you qualify. If you earned less than $99,000 in 2020 or 2021, and if you cannot pay your full rent or a full housing payment because your household income has gone down substantially, you've been laid off from work, or your work hour wages have been cut, or you have extraordinary out-of-pocket medical expenses. So, I mean, there are rules, you know, of qualifying for this program and the declaration that you have to make. But yeah, this seems to be a complete outlier to what the CDC is meant to be doing. Like, similarly to the mask policy, it's like the CDC probably could have enforced a different order in order to accomplish this. Like, advise that this would be necessary, that a protection and a declaration like this would be necessary to prevent the spread of the disease. Interesting. So that's what I learned today. What did you all learn today? Always something to learn. Oh, I lost everybody on Twitch. That's funny. That's cool. We still got our friends here. So yeah, I think that's it. Honor system. We've got to protect that the best we can. And really the only way that we can do it is just with our own honor, right? That's not something that we can enforce or even hope that any federal executive order or state executive order can do for us. We just have to be good people with one another. That's it. That's it. It's pretty simple, right? I think so. Marie, thanks for hanging out today. I'm looking forward to seeing you here in Vegas. Yeah, let me look into it. I think Brian, you asked a good question. So you're guessing the burden is on the person short of rent. It didn't seem to say that the monies would be given for that shortfall. Yeah, I think it's like, what I remember last year reading about it was that you would eventually, you're like, it's not that you're off the hook of that financial liability. It's just you're off the hook until this moratorium is over. Let's see the FAQs. Maybe we can get a better understanding. Yeah, I'll see you in Vegas, Marie. Hi, Gati. So the order temporarily halts residential evictions of covered persons for non-payment of rent during September 4th through June 30th. This means that covered persons cannot be evicted for non-payment of rent from the residential property in the U.S. state or U.S. territory where the order applies. Here we go. Yes, the CDC order does not cancel rent. You must still fulfill your obligation to pay rent and follow all other terms of your lease and rules of the place where you live. You must use best efforts to make timely partial payments that are as close to the full payment as their individual circumstances permit, considering other non-discretionary expenses. This order temporarily halts residential evictions. When the order expires, consistent with the applicable landlord-tenant or real property laws, you will owe your landlord any unpaid rent and any fees, penalties, or interest as a result of your failure to pay rent or make a timely housing payment during the period of the order. Yeah, I can't imagine catching up. So yeah, the landlord or the property owner will be the one on the hook at the end of all of this. I mean, I think moving and filing bankruptcy, like, it may seem like a win, you know, like, oh, I took advantage of the system on that one, but I mean, that's still a pretty shitty thing for somebody to have to go through. But yeah, I think that would be the way to get out. Is the CDC providing rental assistance? No, but you can find update information on eviction protections, rental assistance, and housing at consumerfinance.gov/renters. So, I mean, there are other departments that are involved in this, helping. Excuse me. And so yeah, that's through the Department of Housing and Urban Development. Which did receive $46.55 billion this year to help with this. So CDC is not distributing those monies, but there are monies being distributed. CDC issued this order because evictions threaten to increase the spread of COVID-19. During a pandemic, calling a temporary halt to evictions can be an effective public health measure to prevent the spread of disease. A temporary halt of evictions can help people who get sick or who are at risk for severe illness from COVID-19 protect themselves and others by staying in one place to quarantine. These orders also allow state and local authorities to more easily implement stay-at-home and social distancing measures to lessen the community spread of COVID-19. Housing stability helps protect public health during homelessness, increases the likelihood that people may move into close quarters and homeless shelters or other settings. These crowded places put people at higher risk of getting COVID-19. People who are homeless and not in a shelter also have increased risk of severe illness. Oh, here's the penalty. What are the penalties for a landlord, owner of residential property, or other person with the legal right to pursue an eviction or possessory action violated this order? Several laws provide that a person who violates the order may be subject to a fine of no more than $100,000 or 1 year in jail, or both, if the violation does not result in death. A person violating the order may be subject to a fine or no more than $250,000 or 1 year in jail, or both if the violation results in a death or as otherwise provided by law. What? That's crazy. That's some real talk right there. Jeez. An organization violating the order may be subject to a fine of no more than $200,000 per event if violation does not result in a death, or $500,000 per event if violation results in a death or as otherwise provided by law. So that's it. Oh, thank you, Brian. Thank you. Thank you for blessing me. You know, next time you can just you can use the Seinfeld response. I like to use that one on sneezes. You are so good looking. How many people remember that reference? The company you work with as a consultant is just opting to close its office. 200 plus desk. Many businesses doing the same. If can work at home, do. There are empty places all over town. Yep. A lot of people working from home now. So I think that's it. I think that answered all the questions that you had, Brian. So yeah. It just is pushing off the homelessness until after the pandemic has subsided. That's all it's doing. Yeah, you know, I had actually covered that in a Constitution study group a few months ago, actually maybe like a month ago, about the sustainability, the actual effectiveness of all of the business stimulus packages that were available. Yeah, there hasn't been, especially around the payroll protection loans, the forgivable loans. They completely did not help with employment numbers. You know, which when I did the Constitution study group, the topic of conversation was on, you know, like, what kind of protocol could be added to our Constitution to help better decisions getting made on that front. Because a lot of those decisions were made in haste, they were made behind closed doors, and the legislators used the excuse of emergency. Similar to the argument that's going on here with this eviction protection moratorium. You know, the CDC and the legislators that supported this order cited emergency haste. But perhaps stronger defined protocol on the federal level could help with this. Because, you know, as we saw, the states have those kind of protocols in place, but not on the federal level. It's kind of just like left up to the lawmakers to figure it out. And so, yeah, that's how decisions end up getting made behind closed doors. And we all know what happens behind closed doors. We don't know what happens. But, you know, the people of influence that are behind those doors, they know what's up. They get to do what they want to do. And it doesn't end up being like a truly democratic decision about what would be the most sustainable thing for small business. or just to call it what it ended up being, which exactly what you said. It was a subsidy to extend the cash flow of a small business, which a lot of them ended up shutting down anyway. You know, it didn't really stimulate their employment and their payroll. It just subsidized them to continue operating. Oh, so your idea is that you think it would have been better to give money in furloughs rather than direct, because now we have people not going back. Well, I think the issue of people not going back is a lot deeper than just money. It's something that we've been talking about on this channel and in our groups over the past year, is kind of the inward reflection that people are doing to reevaluate their values, what's important to them. And on an individual level, I think people, especially young people, have all realized that their values are much deeper than money. But heck, I don't know the solutions. I'm just trying to understand what's already happening, what's already laid out. You know, maybe if I continue, this is my hope. If I continue doing this work, like, within myself, some type of resolution will come. And at the end of the day, that's just for me, you know? But it's okay. We can all share our perspectives, and that's where the real magic will be. So thank you for being a part of this process with me. I greatly and always very much appreciate it. Instagram, I'm gonna head out. I love you all. Have a beautiful, restful Wednesday evening, and I will see you all tomorrow for Tea Talks. Be there, Topia, be there. Join us. Oh, there's a mobile version now, so people will be able to join audio only from the phone. Oh, Eric, you're here. That's so funny. Eric, I was just about to like send you a nasty message about how rude it was for you to be texting me while I was in the middle of a stream. Yeah, I'm about to end it. I mean, Erica, I catch you up. You're here now. I'm more than happy to catch you up on what we talked about today. If you're interested. It's okay, Eric. It's okay. I was just teasing you. Obviously, I messaged you back. But yeah, I quit that game. But I'm playing a new game, and I'm so excited for it. It's better. It's so much better. It's called Gods Unchained. It's a blockchain supported game. And I'll do it here, Eric, no problem. Like, why not? That's what the stream is for, to repeat myself over and over and over and over and over again. But basically, and Eric, this could be of no interest to you, but I just like, I looked at the history of the CDC. It was developed in 1946 in Atlanta, Georgia, to support awareness around the spread of malaria, and since has become a vital public health mechanism. It's an advisory committee, though. That's strictly what it is. I played it yesterday. I played it last night for my first time. I was a complete novice at it, but I'm undefeated. You can go back and watch the replay from last night. It was kind of funny. It was really great, actually, because on Twitch, because, you know, I listed my stream under that game, it made my stream visible to like a new community of people. that follow that game. And so yeah, gotta have some nice tea conversations with some new friends, which was good. But it's like a collectible card game. So yeah, the CDC is only an advisory mechanism. But what we ended up finishing the conversation on is that the CDC did do something unique last year. And there are several court cases that are arguing on the constitutionality of the CDC overstepping its position by authorizing an order to protect for eviction protection on residential, and justifying that evictions would increase the chance of the spread of the disease because it would lead to homelessness, it would lead to people migrating and moving around. But for the first time in history, the CDC made an order that is affecting business, affecting commerce. So there's several landlord businesses that are suing the CDC, saying that it's unconstitutional and not right that they can do that. Yeah, so we were just kind of diving into that subject, which of course may not be of interest to you at all. But something to keep in mind is that, of course, they can evolve into more, but we need to have like structure and protocol about how that happens, right? Because even if if you feel wronged and you go to court to argue about something being against your rights or, something that's wronged you, your attorney may be referencing court decisions, laws, or documents that are from 250 years ago. You know what I mean? So when it comes to law and when it comes to our civil protocol of how we interact with each other, there's things written in stone, you know what I mean, that we have to reference. And so a court decision or an amendment, those are all things that are also written in stone, but they can evolve. You know what I mean? So the evolutions have to be documented. You can't just out of thin air. And so that's what's in question now, is that this decision by the CDC, or this order by the CDC, is unconstitutional. And heck, if the court ends up deciding that that's a true statement, it means that an evolution could happen, but it would require, an amendment, or it would require another, set in stone court decision that would open up that scope so that the CDC could constitutionally make those types of judgments and moves. But in regards to the mask mandate, because that was the whole genesis of the talk tonight, is around the mask mandate, because I thought it was kind of confusing how fast the whole culture around mask had changed as soon as the CDC released that announcement. But that is a case of advisory only. So all of the states had reacted immediately. The states that did change their mask mandates, they had reacted immediately. So ultimately the states were the ones who made the culture change. They wrote new laws or new directives that changed their policy on masks. It wasn't the CDC itself. The CDC just made that statement, and then states made their own decision on how they were going to affect their policies based on that advice. So the mask mandate has nothing to do with the CDC, making that actual order. But the eviction moratorium is, and I thought that was really curious, because I thought that had something more to do with economic development and, you know, financial stimulus versus like disease control. But yeah, so that's it. Do you think we have too many freedoms, Eric? That's a strong statement to make. A really strong statement to make. You know, hate's a relative concept. I would not assign that that adjective to your statement or to any ideas that you have. I know you pretty well, T. Sleuth. But yeah, it's allowed. Your opinions and your statements are more than allowed. But you know, hate that's just not something we do around here. And I don't think it's something that you actually do. You could have a strong opinion, but that doesn't mean it's hate. You're funny. Let's see if any T friends are streaming we can go say hi to. T-Fins is, what's she doing? She might be having tea outdoors. It's dark now. Oh, she's reading. What is she reading? We can go say hi to T-Fins. It's been a while since we've raided her channel. Eric, you should stick around. I don't know if you've met T-Fins before. She's in Portland area. Well, have some more tea, Eric. Just have some calming, gentle tea. Maybe some Baojian. I know that's your jam. Brian, so you say most places are still 100% masked where you are. Very few have gone to if vax than to go without. That's so interesting. Yeah, the culture is so different here. What TMI I'm having? Oh, Fushuan. That's your calming tea. I know that for sure. I've been drinking this longleaf orthodox tea from Assam, which is definitely not a calming tea, but I needed it to have this conversation. I needed some energy. Yeah, Vegas is totally different. And it's different in different places. So, like, in the local community here, like, there's still plenty of people walking around with masks into the gas stations, into the stores. But in the tourist spots, I don't know, I haven't gone, but what I have heard is that most people are opting to exercise their newfound freedom. At a proportion that does not equate to our current vaccination rate in this country. So there's that. Your tea was coffee? Oh, Brian, I saw you were up at 4 o'clock in the morning. If I was you, I'd be in my friggin' bed already. Oh, Eric, well, bring your tea right now. You can have tea with me right now. I'll get another infusion going. And then we can go have tea with T-Fins. She's streaming right now. She's reading and drinking tea. It'd be nice to go say hi to her. What is she all about? She's great, actually. She's just a practitioner of tea. Yeah, okay, so we'll go have tea with her now. We'll go raid her channel. Oh man, sleep is like, it's my superpower. I have to have it. I have to have it. I always figure it out one way or another. Like, my sleep schedule does not have to be on any kind of schedule. So like if I need to be awake for 2 days straight, I can do it. But then I am going to catch up at some point, and I will sleep 15 hours at a time or something like that to catch up on it. But early mornings like that, 4 a.m., yeah, that's a challenge for me. That is definitely a challenge. Yeah, we'll go raid her. She drinks all types of teas. I mostly see her drinking aged pu'er. She's a big fan of Yunnan sourcing. But she's been streaming for, I think, like 4 years. She's been doing this for a long time, and she's very active in one of the tea community discords. So I think that's where she connects with a lot of her community. I think it's called Community. I think you're in it, Eric. We talked about that before. It's one of the larger tea discords. She's very active there. That's where she meets a lot of people. And she does, like, she doesn't do necessarily group buys, but for her subscribers and community members, she will, like, share tea with them. And I know, yeah, Yunnan sourcing is a big source of where they get a lot of their tea. And she's a nice girl. It's always good to see someone sharing the tea culture, and, you know, she plays music, she reads poetry, and she's just, you know, peaceful and friendly to be around. So yeah, we'll go hit up her channel. Oh no, this one's big. It's got several thousand people in it. It's a big one. You want to be on an intimate tea Discord, join mine. Probably the most intimate one out there. Alright, let's go hit it. Tell her I sent you, Eric. Make sure you don't leave. Don't leave before we get there. Tell her, the wee tea party is there. All 2 of us. That's too much? Come on. There's only like 4 of us in the Discord. Alright, everybody. Have a wonderful night. Rest well. And we'll tea you tomorrow at Tea Talks. Come to the Topia Tea House. Much love.